Hi, my name's Laura, and I'm going to be your occupational therapist today. What's your name?
Brennan,
Hi, Brennan. Can I just get your date of birth really quick? Just to check it?
11/28/92.
Alrighty, cool. So, is it okay if I work with you today? Alrighty, so in your chart, I saw that you're having some pain over this lateral side of your elbow here, and what that diagnosis is called is lateral epicondylitis. And what that is you're going to have pain over your extensor muscle belly right here, and there's something that we can do called an ice massage. Now, I'll explain that to you, but the first thing I want to do is make sure that you're a good candidate for this modality. So first what I'm going to do is check Brennan for her skin integrity. Doesn't look like she has any wounds or any breakdown. The second thing that I'm going to do is check her sensation. So I'm just going to compare it to your other side. Okay, so I want you to say if it feels the same, if this feels the same on this side, or if it feels different. Okay, does that feel the same?
Yes.
Okay. What about that? Does that feel the same?
Yes.
Okay. Alright, and I'm just going to make sure to go all those areas, making sure that they're the same sensation. Yep, and then I'm going to go on the underside too. Does that feel the same?
Yes.
Okay.
Yes.
Alright, so that was the sensation. Also, I'm going to ask Brennan about her medications. Are you taking any medications now for this pain? Okay, no medications. And then finally for her cognition. So I'm just going to ask a simple question. Do you remember what you had for breakfast this morning?
A banana.
Alrighty, do you know where you are today?
At school.
You're at school. Okay, perfect. So we got those. And then next what we're going to do is make sure that she doesn't have any of the contraindications or the precautions. So for contraindications, do you have any cold allergies, or are you hypersensitive to cold? Do you get itchy or red on there? Okay. Do you have any rare blood disease, or are you at risk for ischemia? No? All right, what about, do your fingers turn blue at all when you have cold applied? Alrighty. Have you had a regenerating peripheral nerve? No? Alrighty. And then have you ever had a history of frostbite or like a blood clot or anything like that? Alrighty. So that looks like a good modality for the contraindications. And then while I'm doing the modality, I'll just make sure to be aware of the precautions. And that would be, I'm going to monitor for your blood pressure, because when we do apply the modality, your blood pressure could rise a little bit, but that's normal. Also, if you had any, I'm going to avoid the circulation that could be impaired, or if you're hypersensitive to cold there. Also, if you have a wound in that area that was 2 to 3 weeks after, I wouldn't put the ice there. Also, I'm going to watch for the superficial nerves and not go over that area for a long time. And also, I would not use this modality for somebody that's very young or very old. But here we have Brennan, so she's a perfect candidate. So now that we've gone over that, I'm basically just going to teach you how to do the ice massage. So first we're going to take a Dixie cup that you can get from anywhere and pre-freeze these. And they're really nice because they're easy to tear. So I'm going to tear off this top half here. And I'm going to make sure that I get all the edges off, so I'm just running my finger along there. And I'm going to make sure that I tell Brennan here, you're going to feel a sensation of pain that goes, or a sensation cycle, I should say, that goes from coldness to burning, and then an aching feeling, and then it's going to go numb. And when it goes numb, I want you to notify me, because that's when we'll stop. Normally, you do an ice massage for about 5 to 10 minutes. So we'll see for this. And like I said before, this modality is good for Brennan because she has something like lateral epicondylitis. You can also do it if people have medial epicondylitis or something like de Quervain's, and it's really good for localized spots. So we're just going to be doing it in this small area here. And okay, so this is going to be cold. Is it okay if I start to apply it to you? Okay. So we're just going to go in this 6-inch diameter around her extensor muscles here, making sure to avoid the bony prominence here, her elbow. And when I'm doing my circles, I'm overlapping them by about 1/2. Making sure to check in with Brennan. Going through the burning stage yet? Keep applying that circular motion, not too hard of pressure. Brennan says she's at the aching phase. Still doing okay? I normally like when I'm applying it, have her arm elevated a little bit like this. I have it on a pillow and have a towel underneath it to catch the water. Alrighty. So Brennan just said that it's numb now, so I'm going to go ahead and stop the ice massage. It's really important. And then I see that there's a little bit of redness here on Brennan, but that's normal. It should go away within 1 to 2 hours. And then we can keep on checking on that. But this is just a really great modality that you can use at home. It's really easy. Just pre-freeze these. And then if you have any questions, you can always email me. And I also have this handout that I made for you, so you can look at that too. And if you have any questions, just let me know. All right. Thank you.